Hi everybody, Jason Ledbetter, sports physical therapist with MedStar. I want to talk about eccentric hamstring strengthening and the role it has with field athletes, sprinters, in regards to injury and strain. Studies have shown that the importance of eccentric training on relative hamstring strength and protection of injury in field athletes, and it's important that therapists incorporate these type of activities in their rehabilitation and training as athletes are transitioning from injury and back to the field of play. So I'll present today some of the things that we use in the clinic that have been established in the literature. Some of those include Nordic hamstrings, Romanian deadlifts, but also it's important to note that concentric training also has a role too, and this is also talked about in the literature. So I think a good treatment strategy when you're in the clinic and you're dealing with hamstring related injury or training is to develop a program of both eccentric hamstring training and concentric hamstring training, and really understanding how to do those effectively. So when do most hamstring injuries occur for track and field sport athletes? They actually occur during the late swing phase predominantly. And what this means for sprinters or field athletes is that they get injured as they're transitioning from this position, okay, right before foot contact. So it's this late swing phase as the hamstring is eccentrically lengthening before foot contact, and then they go into stance phase. Okay, so that's the point that really is the most vulnerable point of injury, and that's why eccentric training has been proposed to have such a beneficial effect. The following is a demonstration of two variations of Nordic hamstring eccentric exercise that we use in the clinic. There are others, but I think these are the two that we use most often. You'll need a partner for this. It is possible to do it by yourself, but in the gym, but you really need a setup where you can stabilize your feet and ankles. That's not always easy to do. It's important to have a good postural setup. You don't want somebody starting in a lumbar lordosis. So if you notice that, they're going to have to pull and tuck their pelvis down. Okay, if they're already flat back like this, you're going to have to cue them to get a little bit of a neutral spine before they even start. At that point, with your partner, okay, I'm going to engage my stomach a little bit. The first variation, I'm going to have the athlete cross their hands on their chest, okay, in one motion, okay, so my whole trunk is going to move together. I'm going to go as far as I can go without falling forward or letting my hands go for my chest, and then I'm using my hamstrings to pull myself back. So they're eccentrically lengthening on the way down, and I'm also getting the concentric on the way up. Okay, so here's a demonstration of this. Yikes! Whoa! Okay, that's as far as I can go. Okay, the second variation is a little bit more ballistic. It involves going down to the table, eccentrically lowering under control as far as you can go down to the table without just shooting your hands down first. Okay, so my hands are going to stay by my chest. And you have to resist the temptation to just stick your arms out. Okay, once I get to the bottom, the athlete can use their hands as an assist, but you're really cueing them to have an explosive motion on the return. Okay, so here's a demonstration of this. Okay. Here are some progressions using the Swiss ball that utilize eccentric contractions and concentric contractions of the hamstrings. It's important to engage the core, be in a neutral position as you come up. Keep the hips level. You don't want to see the athlete have their hips sag during the exercise. And you'll notice that frequently when someone moves to single leg. If that's the case, maybe they should go back to double leg. You can also move some speed into it. You want it to be controlled, but that doesn't always mean slow and controlled. It can be fast and controlled as well.